Okay, well, what I went through, well, I didn't know. I was in denial. I didn't believe that I had an addiction. I didn't believe the family members were actually, I guess, seeing me slowly dying from a young healthy person to an old looking woman. But I didn't see that. My family seen that. They stepped in. They talked with the doctors. They got the intervention going because I was still in denial at the time.
So we've had the crisis with the fentanyl, or what's called Oxy 80 on the streets, and the community behind us has been most hard hit by the addictions, the addiction to the fentanyl, and we've had between 18 and 20 deaths on the reserve in this last year as a result of overdosing, and we've had a number of overdoses in the emergency room. We were seeing sometimes 2 to 3 patients overdosing a day in the emergency room, and now it's reduced substantially. We haven't had any deaths in the community for almost 2 months.
They're providing a lot of education. Healthcare workers are being trained to deal with the emergency. So in the last 2 months, they've had no deaths. They've kind of stopped the crisis. What they have not stopped is the overall problem of addiction, though. So this crisis with the fentanyl deaths is really a marker of a much larger problem, which is the high rates of addiction that blights many of the First Nations communities.
The conference, has been scheduled, as part of our initiative. A few months ago, we declared a local state of emergency in regards to the drug use and drug abuse, prescription drugs. It's been said a number of times, one death with drug overdose is one death too many,
So, like, if my support group or my family didn't recognize that or didn't think that I didn't need help, I wouldn't be here today. I think I would have been dead. They're the ones that helped me understand that I had an addiction